that's real stuff.
Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force briefing for April the 6th. Jumping straight into the numbers, we have 91,847 cases reported so far in Shelby County. In Tipton County, Tennessee, we have 7,145 cases reported so far, 4,823 cases in Fayette County, Tennessee, 20,638 cases in DeSoto County, Mississippi, and 5,530 cases in Crittenden County in Arkansas. Also here in Shelby County, we've experienced 1,574 deaths so far, and the case total increased by 55 cases yesterday. As of last night, we had documented 366,252 total doses. I'm sure that number is higher by now. And over the past 7 days, we had documented 39,942 doses of vaccine administered. That represents 242,572 Shelby County residents have been vaccinated either with one or both doses. And our positivity rate for testing is back up to 5%. So we do want to thank all the people who have been listening to our plea for people to come out and take advantage of the availability of vaccine. And to get an update on the vaccine campaign, I'm going to turn it over to Chief Doug McGowen.
Thank you, David. And as David said, we are up a little bit. As of just a few moments ago, we surpassed the 375,000 doses of vaccine that have been administered here in Shelby County, which is great news. We continue to do that across 5 public pod sites, and the wait times at those sites are under 10 minutes. So I encourage everybody to go out and take advantage of the opportunity we have. We also continue to offer opportunities through our private partners at medical clinics, at pharmacies, at the hospital outpatient clinics. We still have plenty of availability there. And there's more than 51,000 opportunities just this week alone for you to go get your vaccination through one of the public sites. Now, we also have community-based pods, and I think they'll pull up a graphic in here just a second to talk about, in addition to the fixed sites and the private areas where you can go get your vaccination, these community-based pods are going to be coming to a neighborhood near you. This page shows about 9 of those opportunities, and then we'll go to the next page. It shows about another 10 opportunities. So all told, more than 20 opportunities between now and May for a vaccination pod to come to a neighborhood near you. If you would like to take advantage of that, I ask you to go to covid19.memphistn.gov. Take a look at those opportunities. There is a mix of types of doses available. Some people prefer the 2-dose regimen. Other people prefer the 1-dose J&J regimen. But there is a pod coming near you with a vaccine of your choosing, and we encourage you to sign up for those opportunities. Now, when I talked to you last week, I mentioned that we were going to greatly expand opportunities this week for vaccinations here in Shelby County. And in fact, we are growing by 21,000 additional vaccines a week. We have been averaging 30 to 35,000. This week we're doing 51,000. That number will grow slightly next week. That was made possible by a partnership between the Federal Emergency Management Agency, the Tennessee Emergency Management Agency, the Department of Defense, the City of Memphis, and Shelby County, by expanding the operation at the Pipkin building from about 1,500 doses a day up to 3,000 doses a day. Now, those appointments are available right now. There are still appointments available today. That is for both first and second dose Pfizer immunizations. So please, there's still several hundred opportunities today. There's about 1,000 opportunities tomorrow and the rest of the week. Go get your first dose Pfizer, your second dose Pfizer over at the Pipkin building. Now, That 21,000 doses is not just for this week, it's for each of the next 6 weeks. And it's made possible by a partnership, as I said, with the Federal Emergency Management Agency and the Department of Defense. And when you go to the Pipkin site, we are honored and privileged to have members of the active and reserve armed forces with us. We have active duty and reserve members of the United States Marine Corps, United States Navy, United States Army, United States Air Force, as well as National Guard members from Tennessee and the Tennessee Guard on site, helping us with the mission of putting vaccines into arms. It is really inspiring. If you haven't seen an active duty member in a while in uniform, I encourage you to go over there and to be inspired, get your vaccination, and talk to some of these young folks who are eager to help us reach our goal. We're going to provide an opportunity for media members to meet us on site over at the Pipkin building Wednesday. The time will be announced a little bit later in some of the details, so we'll have that for you through our normal media protocols, and we'll get that out to you. Now, I'm going to introduce the FEMA Region 4, which is the southeast region of the United States. Gracia Szczech leads Region 4, and she is here with us today. And without her support, without the global support of the Federal Emergency Management Agency, we would not be able to do what we are doing at the Pipkin building. So I'd like to ask Gracia if she'd come up and give us a few comments about what FEMA is doing to invest in Memphis and Shelby County.
Thank you, Doug, and thank you, Dave. Good afternoon, everyone. It is my pleasure to be here in the city of Memphis and to help support something great that the city has already built. We are just building onto this mission, and as Doug said, bringing extra dosages, up to 21,000 dosages a week over the next 6 weeks, and service members, both approximately 130 of both Marines and Navy and Air Force with the National Guard. We partnered with not only the city of Memphis, but also the Shelby County and the Tennessee Emergency Management Agency and Tennessee Health to make this mission happen. And it's an exciting time to bring more vaccinations to the public and to ensure that we're hitting the underserved communities. That was one of the reasons why we looked at the Pipkin building in coordination with Tennessee Emergency Management Agency and Tennessee Health, and ensuring that this was using the socially vulnerable index. And this site is in particular accessible, whether it's through mass transit, for drive-through, for walk-up. We want to make sure that we're hitting all of that public so that it is open to everybody. So again, exciting time. Looking forward to beginning this effort tomorrow and continuing. Thank you again, both Doug and Dave.
Thank you, Gracia, and now we'll open it up for questions that you may have.
Sam Hardiman, Commercial Appeal.
Hey, Sam.
Hi, Doug. The city has continued to post notices of appointments being available. How confident is the city that it's going to actually give 51,000 doses this week, or is the city still seeing a lot of demand slack? And then I have a follow-up.
Sure. Well, there's no real causal reason that we can point to right now, Sam. We did just come off a holiday weekend. We had Good Friday, followed by Easter, followed by MLK Day. So I'm hopeful that as people get back in their day-to-day routine, they'll begin again to think about the vaccination and get that back into their consciousness. We have every intention of delivering every single dose that we get. I would put the challenge out to Memphians. We can do this. This is something that we can collectively do. We have an opportunity that no one else in the state of Tennessee has. And let me just put the challenge out there a little further. We are leading the state of Tennessee with the number of vaccinations administered by any county by a large margin. It's time for us to put our foot on the accelerator and show the rest of the state what we can do here in Memphis and Shelby County. We are already leading. It's time for us to expand our lead, and I'm confident that we in Memphis can do this. The grit, the grind, the hustle that we all show, let's get out there and take advantage of this once in a lifetime opportunity to significantly increase vaccine availability so that everyone who wants one can get one. So I'm confident, Sam. It's not whether I'm confident that I can do it. I know we can administer it. It's whether people are willing to come and get the vaccination. So I need everybody to encourage their friends, their family, their acquaintances, and people that they know listen to them. Come on out and get a vaccine.
And then my follow-up is just kind of a housekeeping question, but the city put out 22 pop-up sites, I think it is, over the next 3 weeks, 4 weeks. Are those going to be Pfizer vaccines, Moderna vaccines, or Johnson & Johnson vaccines?
Yes, it's a great question, Sam. They will be a mix of Pfizer vaccines, so first and second dose Pfizer. And so if we do a first dose of Pfizer, we will revisit in several weeks. Several of those will have J&J. The partners that are listed for those community-based pods, we are talking to the ministers of those churches, to the nonprofit leaders, and we're asking them what they believe will be the best fit for their constituency and where they believe their neighborhood will come out, because we know that there's two schools of thought. Some people would like the one dose to get it done. Other people would like the surety of the two dose, since it does have a slightly higher efficacy rate. But it's important that everybody get a vaccine, no matter which one you take.
Brad Broders, Local 24.
Hi, good afternoon, Doug and Gracia. I hope I'm pronouncing that name correctly. Welcome to Memphis. First question, Gracia, for you is, could you give the public a little more details about the logistics of the different lanes, how specifically MATA transit, church vans, how that will work, and then I have a follow-up.
Sure, I'll talk about that if you don't mind, Brad. So one of the things that we talked about is to make sure that people get access to the site. So we're talking with President Rosenfeld at MATA, John Zena, who is leading our ESF1, our Transportation Challenge, and the folks on site at the Pipkin building. Because we expanded the site, we have to shift some things around, and so today we are finalizing that arrangement. So the Fast Pass for church vans that will bring people in, the drop-off point for MATA, whether it's an individual rider or through the public transportation stops. So we're working those details out, Brad, and we'll have something on the website where people will be able to navigate that. But because we significantly expanded the footprint, we put more stuff into the Pipkin building, we're going to have to rearrange some things so that we can bring people in efficiently, offload them, make sure we have wheelchair accessibility, ADA accessibility, and then a place where we can administer the vaccines, get them back onto their vehicle and out of the site without having to go through the line.
Thanks. And as a follow-up, this probably is for David. I know the positivity's trickled up a little bit, but for the most part, the cases have sort of remained stable. I know there were some concerns about the variants. Are you all predicting any worst case scenarios between now and June, or what's your take of kind of where we are right now with new cases?
Right. So we're averaging about 100 cases a day. Thank you, Brad. So we're continuing to watch that, but we're seeing the mix of viruses in the community change so that the UK variant that's been in the news quite a bit this week, definitely the variant that is causing the explosion of cases in the Northeast, that is the UK variant. It is transitioning to become the most dominant strain of COVID in our community as well. We're probably sitting between 30 to 50% of all the cases are due to that virus right now. And what we know is in other communities, once it's gone past 50%, so you get to 50% and greater, that you tend to see an explosion of cases. But we also know that COVID vaccine works against this variant. So as you may have heard me say before, we're in a race. We're in a race between how quickly we can vaccinate people and how quickly the virus takes over, the variant virus. And what we are seeing is that the older populations, where the vaccine has been more targeted since December, are actually experiencing a very low incidence of the UK variant strains. So the vaccine is protecting them. But what we are seeing is 69% of the transmission in those variant strains is occurring in people less than 45 years old. And that is the population in our community that is the least heavily vaccinated. So we're appealing to everyone to come out and get a shot. But we are particularly appealing right now to people who are in their 20s, people in their 30s, people in their 40s, to come on out and get vaccinated. Because if you watch the news from Michigan, right now, the UK variant is causing the number of people in hospital in the state of Michigan to explode, and the predominance of the people being hospitalized are people in their 30s, 40s. because that's who's getting sick. So we have a unique opportunity, as Doug just said a few minutes ago, we have a unique opportunity. We are not yet at the point where the UK variant is 50% of all the viruses in Shelby County. And we have an opportunity to administer up to 50,000 doses of COVID vaccine every week for the next 6 weeks. Everybody needs to come out, sign up, show up, and get your shot if we want to get through this fourth surge that is on the cusp of starting.
Kelly Roberts, WMC.
Hey there, good afternoon. First, Doug, do you know at this point of the more than 51,000 appointments that did open up on Friday, how many remain open for the week or kind of a whereabout?
Sure. Well, we probably have another 15 to 20,000 appointments yet to fill. So we have, that means we're filled up about the volume that we've typically had. We're probably about 10 to 15% of the way there with the total new volume that we had. And so there's still plenty of availability for us, We did make a pivot. Even this morning, Gracia and I were talking. We want to make sure that these vaccines are used and that people take advantage of it. So the idea going in was that we would do 3 weeks of first doses at Pipkin, and then we'd do 3 weeks of second doses at Pipkin. Well, as we evaluated the data going into tomorrow, our first real big day of 3,000 doses, we still had a couple thousand appointments available. So we quickly decided that Pipkin will be available for first or second doses. So anyone who needs a second dose can come to Pipkin and get that. Anyone with a first dose can come to Pipkin as well. So our idea is that we're always going to evaluate the data and pivot. There are some other levers we can pull about how we run the operation, but for now, we saw the immediate beginnings of an uptick in appointments being filled as soon as we made that pivot. So we'll continue to do that as we move along.
Okay, thank you. And Gracia, I don't know if you can maybe shed some light. I know that in Region 4 there have been some of these sites that have opened up, at least I know in the Florida area. With your experience witnessing these sites open up, what are the trends that you've seen? Have you seen the appointments kind of trickle in as things kind of get going?
Every state's been different. We've opened sites in Florida, in North Carolina, in Georgia. Most of the sites are appointments only. The sites in Florida walk-ups were also accepted. So they all vary. I can tell you as the second dosages came along, 3 weeks into it, it mellowed out quite a bit in Florida because they were more scheduled appointments. We've seen with the Georgia site, because it's at the stadium, there are some days that they have events. So they are doing dosages by the week, not by the day. There's some nights because the CVC, the Community Vaccination Center, has been closed, that they're doing up to 10,000 dosages a day, vaccinations a day. So it's varied in all of our states. We saw in North Carolina, it is both a drive-through site and a walk-in site. But again, it's by registration only. So, all of them have worked, and they've worked well. Our main goal, again, is to get vaccinations in arms of people. Thank you.
Mandy Rock, Fox 13.
Hi there, good afternoon. I understand the CDC is sending an extra $61.7 million to Tennessee to help combat vaccine disparities in the state, and I'm wondering, will we be getting any of that here in Shelby County, and if so, how will we spend that?
Sure. Well, some of that is, I appreciate that question. The state of Tennessee has received money from the CDC, as you said, for both vaccines, vaccine disparity, as well as continued testing. So that is one pot of the federal money that is coming to the state of Tennessee. We also have received some philanthropic donations to the city, so that helps us with that outreach. Much of that will be spent on the messaging some of that you have already seen, the messaging that's gone out. Much of that will be a reimbursement to the localities that are already doing the work. So That money will be administered to the to the city of Memphis and Shelby County through a grant from the state of Tennessee. We are already working with the Tennessee Department of Health to receive that grant funding to reimburse us from the work. So it really does not change our outreach. As I mentioned last week, with Gracia's team from Region 4, with the national level FEMA administration, when we spent about 45 minutes talking about our in-process review before we launched, 45 to 50 minutes, we spent a full 30 to 40 of those minutes talking about how we embrace, engage the vulnerable populations. And so that was really a heavy emphasis on those strategies. Money isn't always the way to do that. There's only so much that messaging and branding can do. It does allow us to penetrate many of the markets with some purchased kind of awareness, but much of it is word of mouth and influencers through the people in the neighborhood that we engage. So yes, some of that money will be coming to the city of Memphis and Shelby County to help us with that work.
Thank you. Do we know how much we might be getting in the county from that?
So all told, well, I don't know the exact number. We are putting together the budget. We know that there was a north of $10 million allocation that could come to Memphis and Shelby County to help us offset. But remember, that is also the cost of leasing, renting, putting up tents, all the other associated logistics that comes along with this, contracting out with some of the agencies that do the work, both inside the tent and outside the tent, inside the facility, outside the facility. So that's kind of all balled into one. There's the outreach work, then there's the actual vaccination work, and this money is intended to make us whole for those expenditures. And so as I get a more refined number with our budget, I'll be able to share that with you. But suffice to say, money is not the issue when it comes to this. There is a significant amount of money. Gracia and I were just talking, FEMA has a wonderful, very rapid reimbursement program. That's in addition to the money that you were just talking about coming from the CDC that's being pushed to the state. So it's not a function of needing more money to do it. It's just doing the work and getting reimbursed through the most effective and efficient way possible.
Jane Roberts, Daily Memphian.
We haven't talked about the P1 variant. Could you bring us up to date on where we are with that? And then I have a follow-up.
Sure. David?
Hi, Jane. Thank you for the question, and I'm sorry I didn't get to your other questions that you emailed me. I'll do that this afternoon. But as far as the P1, what we can say is we have had 5 different patients or clusters of patients where the P1 variant out of Brazil has been detected so far in Shelby County, and they represent either 3 or 4 independent introductions of that virus into our community. So that means this virus has come to us more than once. It's either come to us 3 times or 4 times. We're still trying to figure that out. But the investigation goes on. We've been communicating with the cases who have tested positive and been sequenced. We've isolated them. We've been working on quarantining their contacts and testing their contacts. It's the same kind of work that we've been doing throughout, but it is sort of focused on those folks with the P1 variant. We've also had another variant called R1 that has showed up in our community. It comes from Japan. So, the main thing I think the community needs to feel comfortable with is that we have a very robust effort underway to detect variant strains as they enter the community, and then our public health response is coordinated and rapid enough that we're able to pretty quickly get those folks in isolation and conduct the contact tracing interviews that need to be done.
My next question is about why FEMA chose to come to Memphis. Were we behind, or what sort of was showing up on the radar that made Memphis the next place you wanted to open?
Sure. This is Gracia, Szczech. It wasn't that Memphis was behind at all. It was the data. We wanted to ensure that we were looking at the underserved population and using CDC's Socially Vulnerable Index. And data is everything. And what we saw is that there was a large underserved population here in Memphis. And working with the state of Tennessee, Tennessee Emergency Management, Tennessee Health, And I know the state then had discussions with the city of Memphis and Shelby County. And that's how it was determined in bringing this to Memphis.
Double checking to see if there's any other questions from media. Please put your hand up if there are any other questions. Go back to Brad Broders, Local 24.
Thanks. I just had one more kind of follow-up question, just bouncing off with the last comments. Do you think with the I know Doug, you were talking about the underserved, how much that dominates the discussion. Any new ideas about how to get the word out? Any new ideas being bounced around that could emerge in the coming weeks?
Well, I am certainly not the expert on all those communications, but I know a lot more now than I did when we started this about how to use Nextdoor to drive some messages down into the neighborhoods, how to take those folks who are influencers in their community, whether they be clergy or other folks, and get them talking about this. And we have a really robust effort there. The overall social media strategy that gets the word out, making sure that we are language sensitive to the folks in this community to make sure that we have as many options as we possibly can. Getting the message out that the only thing we care about is putting a shot in your arm. That's the only thing we care about. Breaking down vaccine hesitancy, as I've talked about, we have a pretty robust effort to get men in the door because men are still lagging behind the women with respect to getting this vaccine. So we are pulling on literally every string that we think we can to get more people in the door, to break down vaccine hesitancy, to encourage people to come. We'll try to make it as fun as we possibly can at every site. I think if people come, and where I think, Brad, the media could help a little bit is in telling those stories. You guys have done a pretty good job of covering this effort. When people see a person on TV read a story in a paper of a first-person account of how their experience was, most people experience no side effects from the vaccine except for maybe a little sore arm. Everybody has had a really good experience at our sites. Our people are happy to be doing what they're doing. They're glad to be stepping up and out each and every day to serve their community. They are so thankful that people are coming. The people that go to the sites are very appreciative of the fact that they got their vaccine. They feel better when they get done with the vaccine because they feel like they've achieved, and they feel like they've achieved a little bit of immunity along the way. So telling those first-person stories, I think, is really what's going to get us home because there's only so much we can do globally. It really has to be that person-to-person, and that's kind of where we're focusing right now is how do we get more people to tell their story. So, and I want to come back to a comment that was that Gracia mentioned. This was an opportunity for us. The state of Tennessee was given the opportunity for FEMA to bring additional vaccines, and it's one that we readily embraced here. Again, not because we were behind, because in fact, when this was first offered to us, we were actually, again, still leading the state with the number of vaccinations that were given by county. So, but, you know, I would be a fool to look at 21,000 additional vaccines and the opportunity we have in this community to say, no, thank you. We readily embraced the opportunity, the workforce that came along with that opportunity, and now we need all of Memphis and Shelby County to embrace that opportunity as well so we can continue to get folks vaccinated so that we can return to normal as we've all wanted to do for as long as we possibly can. So I implore people to get out there, take advantage of this wonderful weather, take advantage of these people, both local Memphians and folks now who have come here from other places to serve you. And they are very happy to do so. So please come on out and take advantage of those opportunities so that David can continue to talk to us about the case rate going down, the positivity going down. When we get a variant, we quickly identify it through sequencing, through the several lab partnerships that we have that are unlike any place else in the state, and very few places in America have this kind of a partnership with a rapid response. We have to take advantage of this, Memphis and Shelby County. We are uniquely positioned to kick butt in this pandemic. That's a technical term if you didn't know. So anyway, thank you all for being here today, and I appreciate your continued attention to this effort.
Thanks, everyone.